In your Health Watch tonight, Henry Ford Health and Ascension Michigan have announced a joint venture that'll be finalized in the coming year.
Essentially, the Metro Detroit locations currently run by Ascension will be controlled by Henry Ford Health and then rebranded under that new system.
Joining us now to help break down this deal is Crain's Detroit Business senior healthcare reporter Dustin Walsh. Good to see you, Dustin.
Yeah, good to see you too.
So Henry Ford says this is not an acquisition, that they'll only be operating these hospitals. So what does that mean for patients in Metro Detroit?
Well, they can call it whatever they want, but it's absolutely an acquisition. They will be operating the hospitals. We don't know what it's going to mean for patients yet, to be honest. It's a new thing. Obviously we have a secular health system under Henry Ford, and Ascension is a Catholic system. So we don't know if there's going to be changes there as of now. Henry Ford says they're going to maintain the sort of Catholicness of the system, and sort of the directives that are controlled by the Cardinals, the Cardinal Health Council that controls Catholic hospital systems. But we don't know what that's going to mean long term, how long they're going to do that for. It is going to be, some culture shock to the integration for sure.
And we're still waiting, Dustin, to see how this impacts the patients. But as far as the companies, any idea of how this could impact them there, especially financially?
Sure. So, Ascension obviously has been bleeding. The entire national company lost $3 billion last year. So they've been struggling. So they've been trying to pare down operations. They've sold some operations in Florida, New York, and other places across the country. So it wasn't a shock to see that they wanted to put some hospitals up in Michigan on the market as well. And Henry Ford has been doing pretty well. They've been doing better. Their plan to sort of become a more regional health care system and beyond seems to be working. They were, financially they're doing better, and they're trying to basically grow at a pretty impressive clip, and this effectively doubles their presence in the region.
So on that same note, what might this mean? Do you have any idea for employees of both systems?
Sure. So as of now, they say the combined system will be 50,000 employees. We don't know. Most hospital systems have openings. They're still trying to hire people. Obviously, there will be some overlap. There's going to be some sort of back-end office overlap, whether that be on billing and other, HR, things like that. So I would expect long-term for them to be some layoffs in those spaces. But again, all hospitals and all health systems are trying to hire like crazy right now. So whether that number comes way down from 50,000, I don't know, but I'm sort of skeptical that it'll move.
We've seen things like this in the past, especially with Corewell Health. Do you think that this is an indicator of what we could be seeing more in the future?
Yeah, we're seeing rapid consolidation across the entire healthcare space. It's very tough to make money right now. Reimbursement hasn't moved, and obviously inflation has gone up, and costs and labor costs have gone up. We've seen lots of labor disputes and strikes across healthcare systems all over the nation, including here in Michigan. So it really takes good operators to keep the financials in the black. And so, in Michigan, we're sort of running out of places to consolidate. We've seen a lot of rapid consolidation in the last 10 years, and there's not many providers left to buy. And so everyone's started kind of carving out where their business operations are in the state. And, whether we see more consolidation in the healthcare, particularly on the hospital side, remains to be seen, but it's certainly going to happen at a similar clip nationally.
So then what comes next in the coming months in the steps for the acquisition, or whatever they want to call it?
Right. Yeah. So it's tough. You have to, go in. They're going to have to create a lot of quote unquote synergies around, their back end office stuff. There's a lot of technologies. They got to figure out what works best, what overlaps best. They're going to figure out how they have to get all of their patient medical records from one system to another. It's a lot of work, and it's going to take a lot of time. And then they have to come in and figure out how to let those hospitals make money, because it's likely that many of them haven't been making money. So Henry Ford's really going to have to focus on operations and streamlining those operations so that they can operate and accomplish the mission of providing good health care to their patients.
Have you been able to get any insight on how some of these employees may be feeling about this change?
I haven't yet. The announcement went out earlier today, this afternoon. I haven't reached out to any employees, and I haven't heard from any employees. These things are always scary for everyone, so I'm sure they're a little fearful. But they might have been suffering under Ascension, and maybe they welcome the change. But right now, we don't know.
All right. Well, we will be following your updates on Crain's. Dustin Walsh, senior healthcare reporter at Crain's Detroit. Always good to have you on. Thanks, Dustin.
Yeah. Thank you.